Dr. Michael Lepore with Sarasota Vascular Specialist here with you today on Whiteboard Wednesdays. We're going to talk a little bit about lower extremity edema and some of the various things that can cause lower extremity edema, and that's leg swelling. And some of those things that can cause and what goes through our minds in terms of what we're looking for. So we'll talk first about venous insufficiency. And see, number one, we have superficial and deep. That refers to the actual systems of our veins. Superficial, as you would imagine, is a little bit more superficially or closer to the skin with regards to where that's located. And the deep system is just that, it's deeper in the leg. And the superficial is part of the system, for instance, the saphenous vein that runs on the inner aspect of our thigh that we use for bypasses and the cardiac surgeons use for bypasses. But sometimes that vein can become very enlarged, and when it becomes enlarged, the valves aren't functioning normally, and there's a back pressure in a downward way that can cause symptomatic varicose veins to come off of those, but can also cause some leg swelling. So that's something that we look for. Thrombophlebitis is clot or blood clot, and that can happen in the two systems, the superficial system, which we just talked about. Typically, that's pretty self-limiting, can just be treated with some aspirin and compression and maybe some non-steroidal anti-inflammatory Advil, Motrin type of medications, or the deep system, which is the more dangerous. Those are blood clots that can occur. That's a DVT, and those DVTs can then flip up to the lungs, and that's called a pulmonary embolism. That can be life-threatening. So these are things we would like to address. Unilateral leg edema. Unilateral means single side, and typically it's most likely the left side. And there's something called May-Thurner disease, which is where in our bodies, the vena cava runs on the right and the aorta runs on the left. They run together through our abdomen, and where they cross over, the right common iliac artery crosses over the left common iliac vein, it can compress it and cause a narrowing, which causes a back pressure, which then in turn can be that the whole left leg is swollen. And we look for that if we see single leg swelling, specifically left leg. So once again, the lower extremity edema that we're discussing about today, a couple different causes: venous insufficiency, the superficial and the deep systems we covered, the thrombophlebitis or the clot, which can ultimately be dangerous to your life if it ends up being in the deep system, and then unilateral leg edema or May-Thurner Syndrome, which is less common, but we do see it and we're looking for it when it's one leg. Dr. Michael Lepore here with you again with Sarasota Vascular Specialist. Feel free to comment or ask us any questions to contact. We're happy to help you and answer all your questions.
Thank you.